Impact of prodromal symptoms on future adverse cardiac-related events. Prodromal symptoms are indicative of obstructive coronary artery disease and indicates myocardial ischemia. Prodromal symptoms are elusive to recognize and understand and respond to because they occur at unexpected times, are transient in nature, and often are couched within existing comorbidities and other disease conditions. Prodromal symptoms are specific and non-specific symptoms a warning sign of an impending or an encroaching acute coronary syndrome event. These prodromal symptoms may be experienced hours, days, weeks, or months prior to an acute coronary syndrome event. And there is evidence to suggest that prodromal symptoms may predict acute symptoms. Current evidence indicates that prodromal symptoms are very vague in nature. They vary in intensity and frequency and are very subjective. Unique to prodromal symptoms are the descriptors unusual and unexpected. Symptoms may include unusual chest pain and discomfort, shortness of breath, unusual or unexpected fatigue, sleep disturbance, gastrointestinal symptoms, headaches, and increasing levels of anxiety. Prodromal symptoms have been linked to treatment delays because of the lack of recognition. There is minimal evidence describing prodromal symptoms and the relationship to acute ischemic symptom presentation or adverse events. In this systematic review, we wanted to examine whether prodromal symptoms were predictive of acute coronary syndrome presentation, cardiac events such as unstable angina and acute myocardial infarction, or treatment interventions such as percutaneous coronary interventions, PCI, angioplasty, stent implantation, and coronary artery bypass grafting, or CABG. We use data sources from PubMed, CINAHL, Embase, Medline, PsycInfo, Cochrane Database of Systematic Reviews, and Scopus. We included mesh words such as prodromal symptoms, angina, acute coronary syndrome, chest pain, anginal equivalents, pre-hospital symptoms, early warning, coronary artery disease, percutaneous coronary intervention, stent, coronary artery bypass grafting, shortness of breath, fatigue. We used and or strategy and limitations and filters. We found 800 unique titles, going through titles and abstracts. Of those, 781 were excluded. They did not meet inclusion criteria. The 19 remaining went through full article reading for screening. We further screened 12. They further did not meet inclusion criteria. We had 7 unique articles to review. Methodological quality was determined by using the Newcastle-Ottawa Methodological Quality Assessment for non-randomized studies. The areas of assessment were qualities in the sample, design, statistics, and outcome measure. Most of the studies were either moderate to strong in quality. Across 7 studies, the most prodromal symptoms were as follows. Anxiety and fatigue were reported in 100% of the studies. Shortness of breath was at 86%. Gastrointestinal symptoms reported 71% of the time. Chest pain and discomfort 57%. Jaw pain 43%, and back and shoulder pain 43%. Dizziness and headaches were also 43%, and sleep disturbance at 29% across the studies. We examined the prodromal symptoms that were associated with acute symptom presentation. Of the 7 studies, 6 studies, or 85%, reported prodromal chest pain, discomfort, shoulder, back, neck, and headache pain, pain and numbness in the hands and arms, shortness of breath, fatigue, and sleep disturbances, and anxiety as associated with the acute symptom presentation. Preemptive prodromal symptoms experienced prior to a heart attack are linked to the kind of acute symptoms one will experience during an acute myocardial event. When examining prodromal symptoms associated with treatment interventions, we found differing results. Prodromal symptoms were associated with increased investigation such as ECGs, echocardiograms, stress tests, cardiac catheterizations, percutaneous coronary interventions, and coronary artery bypass grafting. Interestingly, prodromal symptoms in men predicted more revascularization procedures than women. Of 1,097 women, 77 women or 7% had cardiac-related events or interventions. 39% had stents, 18% had angioplasties, 15% had acute myocardial infarctions, and 5% had deaths. 3 of the most significant prodromal symptoms associated with risk of cardiovascular events were chest discomfort, shortness of breath, and unusual fatigue. Overall, across the studies of more than 4,000 individuals experiencing prodromal symptoms, there were more similarities between men and women than has been reported in the literature. Prodromal fatigue and anxiety were the most predominant prodromal symptoms reported across studies in men and women. Clinicians should assess for prodromal symptoms preemptively on annual visits for risk factor management for cardiovascular disease. Prodromal symptoms are predictive of acute symptom presentation and warrant further investigation with a larger sample. Clinical pearls. Prodromal symptom screening is needed for at high-risk patients. Increased awareness of prodromal clustered symptoms is also required where 2 or more symptoms can occur at the same time. Education for patients and healthcare providers for prompt recognition of the prodromal warning signs is also needed. Preemptive screening of prodromal symptoms may potentiate early diagnosis, individualize risk factor modification, and provide timely cardiac treatment. The next steps, we will need to conduct a meta-analysis of the predictive weight of prodromal symptoms on major adverse cardiac events. Development and psychometric evaluation of the prodromal symptom screening scale is also warranted, with a prospective large prognostic study to understand the importance of prodromal symptoms on major adverse cardiac events is required. In conclusion, individuals who experience cardiac-related prodromal symptoms were more likely to report the same or similar symptoms during their acute coronary syndrome presentation. Early recognition of prodromal symptoms is imperative for effective targeting, screening, diagnosis, and timely treatment to identify those at risk for future cardiac-related events. Preemptive recognition of prodromal symptoms has the potential to reduce unnecessary healthcare burden, influence clinical practice, and improve cardiovascular-related outcomes for people living with heart disease. For more information, please email me or check out the website on the screen. Thank you very much.